Hey, my name is Hannah. I'm going to be your nurse today. How are you feeling? Good. Can I get you to state your name and date of birth for me, please? Perfect. Thank you, Mr. Smith. So I just checked your doctor's orders, and your doctor has ordered us to place a urinary catheter in because you've been having some difficulty voiding lately. So what a urinary catheter is it's a tube that's going to go in your urethra into your bladder, and it's going to help you void. So I'm going to start by raising you to a good working height and putting you in the supine position. And during the procedure, you might feel a little bit exposed, but I'm going to do everything that I can to keep you as comfortable as possible during the procedure. And before we get started, do you have any allergies that I should be aware of, particularly to iodine, betadine, or latex? Okay, good. So I'm going to start by washing my hands and putting a clean pair of gloves on. And we are going to be starting with perineal care. And for this, we are just going to be using some warm water, cleanser, and a washcloth. Okay, so I'm going to start by rolling this back. And I'm just going to place this towel, I'm going to drape it over your abdomen and chest to provide a little bit more coverage and to keep anything from getting on you or on your gown during the procedure. Okay, so I'm going to take my basin with my warm water and cleanser and wash rag for perineal care, and I'm just going to dip the rag in the water and go in a circular motion around the meatus. We're going to dip it again, using a different part of the rag, same motion, circular around the meatus. Dip it again, circular motion. Dip it again, and we're going to go down the shaft towards the pubic bone. And each time we dip the rag, we're going to use a different part of the rag to clean. Okay. So now I'm just going to dispose of these gloves and wash my hands and then set up my sterile field. Okay. So I'm just going to take this out. And I'm going to be using this as my trash bag during the procedure. I'm just set this right here by your arm. Okay. So I'm just going to open away from me first, and then this side, and then the other side, and then towards me. And I'm going to take my sterile gloves out. And I'm going to keep in mind my 1-inch border that I have to keep my sterile filled. And I want to make sure that I don't turn my back on my sterile field or let my scrubs touch it or put my hands below my waist, because then I would have broken sterile field. Okay, to start out, we're going to take the first drape, and we are going to drape it, put in the shiny side down, being sure not to break sterile field. And then we're going to take the second drape, also shiny side down, and drape it not to break sterile field. And I'm going to move this out. And I'm going to go ahead and remove my specimen cup, set it to the side. And I am going to hook up my 10 cc's of sterile water to the catheter. I'm going to go ahead and hook that up and leave it right there. Okay, Okay, now I'm going to take the lubricant and put it in the tray. Dispose of that. Now I'm going to place the catheter tube into the lubricant. Now I'm going to take the betadine solution, open it, pour it all over my cotton balls, and dispose of that. Now I'm going to fluff my cotton balls, make sure the betadine has covered all of the cotton balls. And now taking my non-dominant hand, I'm going to place it on the penis and I will have broken sterile field. So I'm going to take a cotton ball, circular motion around the meatus, and dispose. Same technique, circular motion around the meatus, and dispose. Circular motion around, and dispose. Circular motion, dispose, and circular motion, and dispose. Okay, now I'm going to take my catheter tube out of the lubricant. And during this procedure, if you feel any pain, we will stop and reassess. And when I insert the catheter, I need you to take a couple deep breaths and I need you to bear down as if you're urinating. So on the count of 3, I'm going to insert the catheter. 1, 2, 3. And for a male, we would want to insert it all the way to the Y. This one won't go, but we typically would. And then we would blow up the balloon with the 10 cc's of water and check for urine return in the tube to make sure that it has reached the bladder. And when we put the 10 cc's of water, we will give it a little tug till it meets resistance. Okay, we're going to remove that and dispose of it. Now I'm going to take my catheter bag and I'm going to place it on the bed, not on the patient's bed rail, but at a different location on the bed. There we go. Okay, and now I will tape the tubing to the patient's inner thigh, or you can tape it to the abdomen since it's a male. Okay, now I'll remove my sterile gloves and clean up my area. Now we will get first I'm going to perform hand hygiene and put on a pair of clean gloves. And now we're just going to get the betadine off of the penis with warm water and cleanser and a different rag. So we would dip it and get the betadine off of the penis. Each time we dip it, we'll always use a different part of the rag. Okay. So now if we wanted to get a urine sample right after the catheter has been placed in, we will just come down here to the bag and we would unclamp it right there. Take the lid off, place it in the specimen container, unclamp it, get however much we needed or however much the doctor ordered, flip it back, clamp it back, and I would label this and send it off to the lab. And if we wanted to get one anytime after 5 minutes later, we would get it straight from the port. Okay. So now I'm just going to cover you back up. Take this off of you. rising up. And I'm going to lower your bed to the lowest position. How are you feeling? Good. Now I'm going to put you in a semi-Fowler's position. And make sure the 2 side rails are up. And I'm going to go document this procedure and how you handled it. And I will be right outside. If you need anything, just let me know. Hey, my name is Hannah. I'm going to be your nurse today. How are you feeling? Good. Can I get you to state your name and date of birth for me, please? Perfect. Thank you, Mr. Smith. So I have some good news. I just checked your doctor's orders, and he has ordered us to remove your urinary catheter. So for that, I'm just going to start by raising your bed to a good working height and putting you in the supine position again. And just like before, you might feel a little bit exposed during this procedure also, but I will do everything that I can to keep you as covered as possible. Okay, so I'm just going to wash my hands and put on a pair of clean gloves. This is not a sterile procedure, so clean gloves will do. Okay, I'm just going to roll your covers back. And your gown up. And I'm just going to place this towel on the bed underneath you to keep anything from getting on it. And before we take the catheter out, we would empty the bag in the appropriate container. Okay, so now we are going to put the syringe in and draw up our water to deflate the balloon. And I'm going to check to see that I got the 10 cc's back out, and I did. Okay, I'm just going to go ahead and unhook this, bring it up here, and untape it from your leg. Okay, during this, I need you to just take a couple of deep breaths, and on the count of 3, I'm going to pull it out. 1, 2, 3. Good job. Now I just wrap it up in this and dispose of it according to hospital policy. How are you feeling? Good. So I'm just going to cover you back up. And I'm going to lower you back down to the lowest position and put you in a semi-Fowler's position, and make sure that your 2 rails are raised. Okay. And you handled the procedure very well, so I'm just going to go document the procedure and how it went. And I'll just be right outside if you need anything. Just let me know. I hope you have a great rest of your day.